and Karen will probably talk a little bit more about what the local CCR&Rs do. But one thing that's really important to know is that they are entering the providers into the database that we're using to search for childcare. And they're working directly with them to update their vacancy information, get updates about all the details about their program, and then we share that database and provide the information to the parents that are calling for childcare referrals. When we provide a referral, it's based on a lot of different factors. So we try to find providers that are going to actually meet the parents' needs. So we look we ask the parent for the location that they're looking for childcare. We talk about different childcare types and try to find the type of care that they're looking for. We ask for the hours that they need care, the ages of their children, if they have specific languages that they want the childcare provider to speak. And any other details, special needs, special food requests, things like that. We can provide the referrals basically any way that the parent asks for. So we can do it over the phone, we can email, we can text the referrals. Parents can search online on our website. And then we can also even mail the referrals through the post office. We also provide information about quality childcare. We give some tips and some guidance around what to look for in a child quality program, how to contact Oregon's Office of Child Care to check and see if there have been any complaints or compliance issues on that specific program. And then the other thing that we offer are extended hours. So we're open on Monday through Friday from 7 o'clock in the morning until 11 o'clock at night for parents to contact us for referrals. And then we're also open on the weekends on Saturdays and Sundays from 8 a.m. until 8 p.m. Then you can move to the next slide. This is just a piece of outreach material that you might recognize. These are kind of handed out throughout the state. And it gives our contact information, hours. So you can dial 211. You can text the keyword children to 898-211. You can email children@211info.org, or you can visit our website. And there is a childcare search tool on our website as well. And then I pulled a little bit of information specific to Washington County. From July 2020 to June of 2021, so the last fiscal year, there were 2,222 parents searching for childcare on the online database. So it's the search tool online that parents can just search on their own. We had 493 phone calls from Washington County looking for childcare, 188 text messages, and then about 69 emails from families looking for childcare. Other things that people are looking for when they ask for childcare referrals in Washington County that came up on a report that I pulled were financial assistance for childcare, lots of other types of financial assistance, including like utility assistance, money for food, just kind of extra money to help serve people's needs, legal services, and then consumer and public safety services. So that kind of includes like public health information. There were a lot of calls regarding like COVID related public safety questions, questions about childcare and safety, health and safety, housing resources, utility assistance, food, and then healthcare. Those were kind of the top ones that came up on that list for us. And those are really specific to the people that were calling for childcare. So those are what the families were looking for. And then relating to what families are asking for in childcare specifically, currently what parents are calling us about right now is a lot of people are looking for childcare starting in September. So they're really planning ahead for when school starts. It's hard because some parents don't really quite still know what to expect because of COVID, and they're just not 100% sure what the school year is going to look like, but they're really trying to start looking because it's rough trying to find childcare right now. We also are still getting calls for school-aged summer care, so things like summer camps, and just other childcare for parents that are working during the summer. Preschool, infant childcare. We've been getting some special meal requests, part-time and drop-in care, extended hour and weekend care is needed. A lot of people are still calling looking for financial assistance for childcare and really unaware of the employment-related daycare program. Currently, they have extended the income limits so you can make more money than in the past, and that's due to COVID. And then they've also gotten rid of the co-pays, and a lot of families that just have never qualified for employment-related daycare are calling us, not really realizing that they're eligible right now for that service. So we tell people about the program and help them to get a hold of ODHS to apply. There are also a lot of families that are over income for financial assistance for childcare. So they're not eligible for that program, but they still can't afford childcare right now. And they're also calling. A lot of people are looking for childcare in their own home. So for various reasons, sometimes they have a child with special needs, and they just haven't been successful in finding a provider that really can work with their child. Sometimes they have lots of kids that they just want to keep in their own home. Sometimes they're working late night shifts and they want their child to sleep in their own home. That's a little bit harder for us to find. Often we're not really able to find that specific type of childcare. There's transportation inquiries. Often people need, especially during school, they need a childcare provider that can take their child to school and then pick them back up, especially with the hybrid schedules that happened in a lot of counties last year. Parents just couldn't transport their kids back and forth as much as needed. And that was really hard to find due to childcare regulations. A lot of providers weren't doing transportation in the last year. And then again, a lot of families looking for programs that can support children with special needs. Are there any questions?
I have a question.
Sure. Go ahead.
So, are you finding that people are needing childcare, but they're still a little bit hesitant to use it because of COVID at all?
You know, I reached out to my staff last week and kind of asked, like, what's the status right now on what people are asking about, like health and safety guidelines during COVID and things like that. And they told me that about in June of this last year, so about a month ago, people just kind of stopped asking. So I think now that things are opening up more, maybe people are just trusting, or I'm not hearing it as much now.
Okay.
But again, you know, we're getting calls from people that have just gotten a job, or they're really being asked to work, and they are pretty desperate for childcare too. So
and Angela, in some cases, what we're seeing with Preschool Promise, we actually have a new summer program that goes like for 8 weeks, right? In some cases. And so some families were telling us, you know what, the state just opened up, the school just ended, we want to be outside and we want to do things with the family and we want to see relatives. So it might be for now like a second priority for some families, or a lower priority, but it will change. Yeah.
Mm-hmm.
If you know, I wouldn't mind jumping in really quick too. You know, I think from what we've had the opportunity now to with our Head Start program, we've basically now had, this is our second summer doing a summer program, and just by comparison's sake, you know, last year when we ran the program, originally interest from families was really high, but those who actually participated, I think we saw about 20% of those who expressed interest actually ended up showing up to participate in the summer program. And it's much different this year. The rates of who was interested and who's now actually showing up and participating are much closer. So I think in some respect, we're seeing some families get much more comfortable with, you know, we've had a year to get used to protocols and how we maintain safety. So I think there's more comfort that we're seeing in families that we're working with. But I can also say, as a parent of young kids myself, it's still, we just put our kid back into preschool about a month ago, and it's kind of that calculated risk that we're taking. You know, 3 out of 4 people in our household are vaccinated, so we're taking our calculated risk there.
Yeah.
So I have actually a second question, sorry. So the other question was, so the families that were getting jobs and they're transitioning back to work, I know we have a childcare desert. Karen, I can hear you in my brain already. So as people are calling 211 and getting those referrals, and trying to find childcare, how much do they have to choose from? How many referrals are they getting? Because I'm hearing even our own staff were having difficulty finding childcare for their own kids, let alone the families
Yes,
that were
I
finding
got my
childcare.
bike back there.
Say it again.
I have my bike.
Okay.
So when we get calls, the way it works is that we search a list, and if the provider is set for referrals, that we give the referral to them. The vacancies can change so quickly that we can't always guarantee whether or not the provider has a vacancy. So we give the rule for us that we follow, due to just guidelines that have been set by the early learning division, is that we give 3 to 10 referrals at a time generally. And then it's up to the parents to reach out to the provider and find out if they can take their child and interview them and go through that process. Sometimes
there's
we hear back from families that they weren't able to find anything, and then we give another list
Okay.
and they keep trying. It's hard to say whether or not they're successful sometimes. That is something that we're still kind of working with the early learning division on, is a process to really understand if people are successfully finding childcare or not. We offer a follow-up after 2 weeks to families, but it's really hard to get a hold of them again 2 weeks later to really go through that process. They don't always follow up and let us know.
Thank
I
you.
don't know if that answers the question.
Well, it doesn't. I mean, we just tell people to call back and get more referrals. I think it's just like what's the capacity out there for providers? Do we have enough providers? Do we need to be recruiting for providers? It seems like there's always not enough, but I don't really know what the demand is, I guess.
Yeah.
I'll be able to get to that.
Thanks, Karen.
Okay. Next slide. Karen Henkemeyer, Program Manager, Child Care Resource and Referral. Go ahead to the next slide. So Child Care Resource and Referral in Oregon. You'll hear CCR&R a lot, and I apologize for the acronyms, but that's the way our life is. So CCR&Rs have been part of the state of Oregon for over 30 years now, and primarily we are funded by the Early Learning Division. And so the state of Oregon right now has 15 service delivery areas for child care resource and referral. And then we're housed in different entities. There's 3 of us in the state that are housed in community actions, but several are housed in community colleges and then also education service districts. Next slide. So one thing that families and providers need to work with to help support families is the employment-related daycare, also known as ERDC, and that subsidy helps the low-income families pay for childcare while they're working. So ERDC is a subsidy, meaning that eligible families still pay for part of the childcare. So at this time, it's $0 copay, but that's only through the end of September, and then October 1st, it reverts back to pre-COVID levels. And I think Angela could agree with that, that's also what you've heard? Yeah, okay. So what our team does is we support individuals who want to become listed. So providers who want to accept families who receive the subsidies. So there's a listing form in which you have to fill out. Everyone in the household needs to have a criminal history background check who's 16 years or older in order to be a listed child care program. You can be listed with DHS if you're an exempt provider, which means that you care for 3 or fewer children, or if you're a licensed child care program. So listing is available for all types of care. And so also the Oregon Department of Education houses the Early Learning Division, and within that is the Office of Child Care. They are the regulatory agency for child care in the state of Oregon. And what our job is to support individuals who want to start their own business, want to continue their professional development, to renew their licenses. And we work with all types of childcare. We work with staff from Head Start, OCDC, Adelante Mujeres. We also work with providers who are opening their care in their own home and license exempt. There are different rules for all different types of care. So Oregon has a quality rating improvement system that rates child care providers. Not all programs are involved in Spark. It is voluntary. And so COVID has definitely negatively affected our high quality programs. So in May of 2020, we had 82 what we call Spark rated programs that have gone way above and beyond what licensing requirements are. And then in this May, we had 75 Spark rated programs. So also within that last year, we had a lot of our Star 5 programs that were not open because of COVID. So it was a rough year for childcare programs. And so capacity in Washington County, like Angela said, is a childcare desert. And what that is a childcare desert is defined as an area where there are 3 or more children for every 1 regulated slot. Okay. All of Washington County is in a childcare desert for children under the age of 5. But the really scary stuff is for children under the age of 2, there are 8 children for 1 slot. So we are in a crisis desert for infants and toddlers. We are as a state, we are as a nation. It's not just us. And one of the things that we kind of rate low in Washington County is only 10% of our children 0 to 5 have access to publicly funded childcare. That has recently increased. This is a 2019 report from the Oregon Child Care Research Partnership at OSU. So it has increased with additional slots for Preschool Promise and OPK. However, we are still one of the lowest in the state as far as publicly funded. There are just not enough childcare providers to meet the demand, and providers are leaving the field in numbers, record numbers. And it particularly affects families of color, families living in rural areas with children with special needs. That's also directly from the Early Learning Workforce Report. So the workforce, the low wages, high turnover, and not enough support. So currently we have, well, not currently, 2019, we had just under 4,400 individuals working in a regulated childcare facility. 23% of the 2018 workforce left the field before 2019. And this is all Washington County data. Workforce turnover has only increased during the pandemic, and a large portion, 42% of the workforce identifies as Black, Indigenous, or people of color. One of the things that we work with at the CCR&R a lot is increasing the opportunities for individuals who speak a language other than English to support them in their professional development. And what we see is that there just isn't enough coaching, training, and continued support for individuals who speak a language other than English or Spanish. You know, like about 5 years ago, when Begoña and I started working on our focused childcare networks, working through Spark, there was nothing out there for Spanish-speaking individuals. There's a lot more now. So it takes a lot to increase the professional development support for individuals who speak a language other than English. The affordability. So Washington County is the least affordable county in the state of Oregon. A married couple can pay an average of 12% of their income, and on average, 25% of single parents pay 25% of their income goes to childcare. The average monthly price for full-time care is over $1,200 a month. The state average is $710. That's 19% of the median household income for a family with a child under 6 versus a state percentage of 14. Nationally, we would like all families to pay no more than 7% of their monthly income towards a child care expense. But as you can see, that the price comparison, center-based care for infants is $1,300 or $13,000 a year, and that's actually low. We are seeing increased amounts of about $1,800 a month per center in infant childcare. And thank you. Any questions? I've kind of gone through a lot quickly.
Karen, I'm wondering if, when you talk about, some of the barriers that the system is facing with being a desert, we talk about the challenges for workforce, cost of families, wages. How do facilities factor into that complication as well? Is that for providers being able, even if you're interested, how hard is it to even find a space if you wanted to open a small center or something like that?
Oh, Kemp, I'm glad you said that. It is incredibly difficult to find and to start a building for a facility of childcare. We actually work with Hillsborough Planning Department, and it is such a financial heavy lift to build a center, let alone build a center from the ground up. It costs thousands of dollars. It could take years for the permit process. And then just for individuals who are opening up in their own home, there are issues with sometimes HOAs or rent. So it is definitely one of the factors that keeps us from increasing the opportunities of more childcare programs. One of the things that I wanted to speak to about Angela's question. So right now we have about 3,000 vacancies for childcare in Washington County. So that's not a lot. It's usually up about 10,000 vacancies in pre-COVID times. So we, pre-COVID, we had about 815 childcare facilities on a whole. Right now, we have just over 600 programs in Washington County. We're doing lots of work to help open up new businesses, providing trainings that are required by the state of Oregon to do so. But the wages are so low, it's hard to get people into the field. Thanks, Kemp. Any other questions?
I'm saving mine for the end of the presentation, so.
Okay, thanks, Glenn. All right, Begoña.
Okay, thank you, Karen. So I am not going to talk much about the work of Early Learning Washington County, because I want you to go to our new website that we just launched on June 30th. And it is amazing, not because we did it, but it's designed for parents with parents, and information is just one click ahead of them. I will say, like 211 and CCR&R, we also partially funded by the Early Learning Division, and we are 16 hubs in the state of Oregon. And we also have like different, a mixed delivery, like backbones organizations that are the ones supporting the hubs. And in our case, it is United Way and Washington County, Health and Human Services in Washington County. So we talk a lot. Can we move to the next one, Glenn? We talk a lot about providers, but we actually didn't talk much about the children, right? And I want you to understand that this is data from the census, I believe was 2019, 2020, so it doesn't include the most relevant one from this year. But we have approximately over like 500,000 people living in Washington County, and out of them, 5.8% are children under the age of 5. So that means that we have almost 35,000. And out of those 35,000, we still have 7,000 children that have not been accessing early childhood services, period. Let it sink. Nothing all the way from prenatal to the moment that they enter kindergarten. And why do I talk about this age range? It is because the work of early learning focuses on prenatal all the way through the age of 6. And we only have one exception, that it is with the space program that we run in Beaverton for the Somali community that goes all the way like K through 12. But other than that, we focus, like I said, in services or programs of funding, making investments for programs that serve the prenatal all the way to first grade or kindergarten. So this slide that we have here is connected about how we make investments and how I partner with Karen, CCNR, and other local agencies or agencies in the Tri County. So this slide is actually connected to our sector plan. So I will have to give you like the story of so far of what happened here. So all the 16 hubs in the state of Oregon have to come up with an early care and education sector plan in 2019. So the plan was, and it is data informed, it's family driven and community inclusive. And as part of the plan, you have the priority population list, the supply and demand analysis, and the family needs and preferences, and an expansion opportunities section. In order to do this work that it took us several months, we actually partnered with the Coalition of Communities of Color. And so the coalition provided this ECE family engagement report, elevating like family voice through the participation of more than 500 families, and 368 of which were identified as being from communities of color. But the coalition didn't do this work alone. They did it in a partnership with APANO, Adelante Mujeres, Tierra Agua, IRCO, and other agencies. But since they only focus in communities of color, we also have to hire an independent bilingual researcher that interview families from the WIC and ODHS program. So there were like different layers here and a lot of complexity. So this mapping and family engagement report is actually a public resource to help inform and guide closely our work, but also the way how we make investments. And at this point, our stewardship committee, the Early Learning Washington County Stewardship Committee, told us and voted on focusing on these priority populations that are listed here. Let me, both Kerry and Karen talk a little bit about the inequities that our families face, but let's talk a little bit about the ones listed here. So some of the inequities that they are facing is access to service. Sometimes there are geographic areas when there's no service. Sometimes the income of the families in the area is above the eligibility criteria. And this is because what Kim was asking, like space. Sometimes providers can only find spaces in areas that are like wealthy. And that means that families might not qualify for those programs like Early Head Start or Head Start if the FPL eligibility criteria goes up to like 130 or with preschool promise up to 200. Also, transportation, whether if it's because of the cost of providing transportation, the liability, or because they can, there's not the insurance, so therefore transportation might not be offered. Service equity, there is a limited number of culturally and linguistically services available. We hear that more and more families are asking for this type of services. And we have a lot of providers now in Washington County that offer bilingual or multilingual education, but we are far away from what we are supposed to be. The cost of service. You guys talk about not qualifying for ERDC, and that sometimes paying for childcare is more expensive than paying for the mortgage, paying for your rent, or paying for tuition in PCC, right? And also service is not available outside of regular hours. So that means those like working night shifts or like weekends or holidays, right? And with that comes a piece of premium for the insurance, right? So it's more expensive. You also need to hire more staff. And obviously the FPL, right? We have a lot of families over income for just a few dollars. With Preschool Promise, we are rejecting families because it's just $300 over the limit, and it breaks our heart. But we talk a lot about the families, and now let's talk about providers. And Karen mentioned some of these inequities that providers are facing. One of them is the lack of professional development, right? We talk about bilingual degrees not available in our region, limited or translated or adapted content in some languages, and then challenges to access economic resources, whether if it's because of the public charge law or legal status, or sometimes purchasing the insurance or providing transportation is a challenge. Also, some of the providers and the clients are impacted by trauma or stressors, whether if it's because COVID, or some are coming from war zones like Iraq or Syria. And now we have people from Venezuela being resettled. And like Karen talk about this thing always, really low paid jobs with extremely high turnover. And this is really hard to work with. The way how we partner with community action, and this is the focus of the next few slides. I'm gonna talk about how we make these investments and help to reduce some of these inequities. And can we, Glenn, can we move to this one? And these are some of the good news that I wanted to share with you. So last year, Washington County invested $14.5 million in grants for both childcare and school districts. This year, we just got the green light. Was it last week, Karen? Last week, right? That we're going to be getting $3 million. And so there were like 3 proposals, and the 3 of them have been granted. So one was for childcare, the other one was for essential needs, and the other one, the last one, for home visiting programs. Those 2 are not included here. But let's talk about how this is supporting reducing inequities. So for instance, the first one, like capacity analysis. By allocating funding to assess the current facility capacity, we will be able to better understand where saturation is taking place, whether if it's in some geographic areas or we have specific languages, right? And or where an expansion is needed. An expansion is gonna happen. For next year, we have probably the expansion of OPK, preschool promise, and if we get lucky, we will have preschool for all as well in a couple of years or 3 years. The other way how we reduce inequities is by supporting the professional development, the increasing quality of service. So the Focused Childcare Network. Karen was talking about when we started this Focused Childcare Network, and it was the only thing. We started with one, we supported 2 of them for Latinx childcare providers with just $58,000 and blending funds. And Karen and the CCRNR team, they did their magic. And we have been able to continue supporting this Focused Childcare Network, but it is time to grow that thing. And so this funding, the idea is to grow the Focused Childcare Network from 2 to 12. And these 12 new Focused Childcare Network will be focused on BIPOC multilingual childcare providers. And so Karen touched base on what a Focused Childcare Network does, but it's basically coaching and training to providers that English is not the first language, and also supporting them with portfolios for Spark and a lot of things. And so we are really, really excited about this thing. So Karen, you wanna add something?
So what makes me so excited is that this is funding that we have hoped to build our family child care networks, because they are the ones that work more hours than 40 during a week to care for families and are the most isolated. And we have found with having one of our team members work with a group of family child care providers definitely makes an impact as far as continuous quality improvement, as well as building a community and support within the cohort. So it works, and we're really excited that we will be moving towards increasing those that speak Spanish into the cohorts, Arabic, and hopes for other languages as well.
And that comes up with 2 issues. Number one, we need to be able to find the staff that it is bilingual, bicultural in those languages or communities that we are targeting. And the second thing is we need to be able to support this thing beyond the 2 years lifespan of this funding. So we will cross that bridge, but for now, we are really excited. Another way how we support providers is around strategies with retaining or expanding the capacity. So these new grants that we will have available, I don't have the details yet, but I think that is around $700,000, combined with the $248 million that the state of Oregon is going to be investing. I think that that will be a relief for childcare providers. And we also, I want to talk about this project because it is really close to my heart. So I said that we have a lot of stressors and COVID impact, especially around for low-income families and BIPOC families. So by providing funding to support the social emotional learning experience, so that means like purchasing curriculum, but also offering the coaching and a technical assistance. The goal of this, and Karen, I might need your help here, but it's basically to support providers in their quest to implement developmentally appropriate strategies for understanding and regulating emotions and practicing self-care, guiding families on how to create supportive home environments. So this is something that Spanish speakers and those that speak other languages really don't have access to these resources. And Karen is also talking to the vendor because the curriculum is in English, part of it is in Spanish. So now we have to add an extra step of whether if it's printing things, assembling kits, just to make sure that providers have that information, that content.
Yeah, one of the things that Begoña and my team have really worked towards is making sure that what is available for individuals who speak English is also available in Spanish. And there have been many different vendors where I will go to them and say, well, what do you have in Spanish? And only part of it is. And so when you talk about supporting families as well as the providers, after the pandemic, those that have been marginally, who are really needing the social emotional help are those from our BIPOC community, especially those who speak Spanish. Washington County has been hit hard with COVID for the Latinx community. So I think I was on 3 different calls now with the vendor is called Second Step, and they're based in Washington, and we asked them if they could create sets for this curriculum in Spanish. And again, they just have partial. So we only will be able to provide a partial curriculum to our Spanish speaking individuals, but they have heard me. I definitely went into their leadership and said, this is who we really need to be supporting first and foremost. And so we've been able to make progress there. But in addition, with a national agency called HSI, I don't remember what it stands for, but they house nationally the infant and toddler first aid and CPR training. And so I was able to work with HSI to get the training translated into Arabic and Spanish. And as well as I worked with Multnomah County CCR&R, and they were able to fund the translation in Vietnamese, Russian, and traditional Chinese. So first aid and CPR is the core piece of training that all individuals who work with children need, yet it's not available for most. So this has taken us years to get to this. And what's so exciting is these are available online. It is difficult for some individuals to work through technology to access this training, but that's what my staff does, is support them in working through this. So that was a big win for us.
Thank you, Karen. They couldn't have a better advocate than you and your team. Can we move to the next slide? And so these are some of the things that we are also doing right now. We are focusing on the providers' business practices, which is a really huge gap for childcare providers. So as we speak, earlier in Washington County and CCNR, we are exploring the possibility of partnering with Centro de Prosperidad and the Hillsborough Chamber of Commerce. I don't know if that's still the name, Karen, but I'm going to use that name to provide business acumen training and technical assistance. So some of the, even if they are running their business, we through the work of helping them to apply for Preschool Promise and other grants, we realized that they have a limited understanding about how to access resources or investments to start a business or to maintain a high quality program. They also have issues or lack of understanding about how to create a budget to support their business or to support a grant application. This was a huge issue that prevented many of the providers from becoming part of the Preschool Promise cohort this year. The fact that the state didn't provide the same level of technical assistance and support that it was provided in the past. Many of the most vulnerable ones tried to access this funding, and they just found challenge after challenge after challenge, and the CCNR team and the HUB team were there to support them, but it was not enough for the level of support that they actually needed. Also, how to understand something like payroll, contracts, policies, record keeping. For many of them, they are expanding their businesses through public funding. And this is the first time that they are going to be hiring people, or they were hiring people, and they do know how to do these things that many of you is like, yeah, with your eyes closed, you can do it, right? And also something like promoting their business. So we have to be helping them with marketing and outreach about where their business allocated and what they are offering. And one of the things that is also really exciting for us, it is around policy and regulation. So Karen started meeting already with some of the municipalities. So the purpose is to better understanding like issues around zoning and licensing regulations, but also on our end is how to educate cities around childcare issues. And obviously we will always try to secure investments, right? So I want to finish my slide with something. I love to share things, but I always, when I share things about issues, my share always comes with an ask. And I know that some of you might be wondering, what can we do? How can we help? So if we move to the next slide, these are some ideas, and I don't know where you fall within these categories, but for instance, I hear that some of you got ARPA funding for developing housing, right? So what about co-location? What about conducting awareness workshops about what are the requirements to provide childcare services in your location, right? So that they don't get on trouble because they do not understand the regulations. So if you are, for instance, a higher education that I don't believe that we have anybody, but we have work system. So could you provide accreditations, degrees in Spanish? Could you provide funding to do this thing? Could you have concentrations around specific topics? For instance, STEM, right? So with this, we open the floor. If you have questions, feel free to ask questions to any of us. Not just me, any of us. Especially not me.
Thank you, all three of you, for the tremendous amount of information that you've shared. Does anyone have a particular question?
I got a question, and I did have to step away for a minute, so I'm sorry if this was something that was already covered, but I know hiring in childcare has been a huge obstacle, and wages have been low for forever in that industry. You know, what are things that are going on to help support those workers, or to I don't know if there's something on that side of it that's that anyone can be working to address. I mean, it's like, oh, I mean, everything is so expensive, but then I mean, it's like, oh, the cost of healthcare is so high, and these people aren't getting paid very much. So like, how, you know, all of that is just, I think a big. Like, how does all that work? How do you pay so much and then nobody gets paid to do it?
Right. So sometimes we solve an issue and we create another issue, right? So for instance, like Preschool Promise actually setting a minimum of salary that and accreditation that should be paid or compensated to providers or teachers, right? But some organizations, like I'm gonna pick on Community Action, right? Since they are here. So let's say that they have the same classification for that teacher or teacher aide or teacher assistant, but they are coming from different funding streams. Just because they're coming from different funding streams doesn't mean that they can increase their salary to those hired to provide services for that program, right? So even if we try to solve the issue in one way, sometimes, you know, like I said, we are creating another issue.
I appreciate that you brought that up, Begoña. It's because it's totally true with the Student Success Act that passed. That's any Head Start program was kind of struggling with that, particularly ones that are community action based, where you have employees across a range of things. But yeah, that's certainly a challenge. But it's also, you know, my thought on that is too that the childcare or that profession, a lot of it is driven by. You think about it as a marketplace. A lot of that is being driven by the public space. So on one hand, you need that public push from the legislature to kind of push those salaries, and maybe that will start to impact other parts of the sector to bring it up. But so it's good. We've been able to advance pay for a lot of our teaching staff. Yeah, it is complicated, as Begoña noted, with the funding streams.
Another thing that we are intending to do also with early learning Clackamas and early learning Multnomah is some PSAs or videos to encourage people to be part of the field, the sector. But obviously, when I think about somebody that just graduated, went through the effort of paying for a degree, and then you are facing that you might be paid like $14 an hour or $15 an hour, is really discouraging. But yeah, we have to do a lot of work, and we will partner with CCRNR to do it. And I hope that we can partner with Andrew as well.
So one of the things too I want to mention is private-public partnerships. That's what we need to incorporate in our community is the large businesses that could financially support childcare. And for example, there could be employers that support helping pay for childcare. They could help pay for just the professional development that's needed for individuals. Providers who have their own business, they work Monday through Friday, sometimes 6 a.m. to 6 p.m. They also have to take training for continuous quality improvement. They don't have easy substitutes like the K-12 does to have somebody, you know, walk into their home and care for the children so that they can get training. So that's an area in which we've been talking about in the metro area as well as in the state about how do we create a subpool similar to that of K-12 to support early educators. Well, the only way to do that is to pay higher, right? And so we do have to increase our wages for early educators. And a way to do that is one of the things that the city of Hillsborough and the city of Beaverton are planning on supporting also a project with us, and that's getting people to work through the CDA credential, and that's the Child Development Associate credential, which is like the core training to enter childcare. And in order to do that, it takes registration fees, it takes lots of hours of training. And so what they're planning to do is help support that financially to get people ready to complete their CDA, to start being able to work in childcare. But in addition, we have PCC at the table talking about how a CDA can be articulated into 15 credits at PCC. So once we move them from that CDA, we want to continue to move them through community colleges in hopes of a 4-year degree in the end. So
I just want to add something to that. It is the way how sometimes we are re-traumatizing childcare providers. So we are hoping many of them are small, right? Is one person running everything. or limited support. And so we are expecting them to apply for a Spark, submit portfolios, keep taking courses, classes, certifications, but they have to pay for that thing somehow, right? Without the scholarships, they cannot do it. The content materials have to be available in their languages, right? But many of the providers are closing 1 week the whole year. And then the courses that we are offering to them is on Saturdays, on the weekend, which it means that they do not have a break, right? So I wonder if we could put together like what we learned from the past that worked or didn't work for providers and what we learned from COVID, and blend those things together and come up with something that really in the future, in 2022, might work for providers.
And Andrew, you talk about a childcare apprenticeship program being developed. That's very exciting. I'd like to hear more about that. I know that in California, there are some very successful apprenticeships that have occurred. They can't exactly classify them as an apprentice. So it has to be worked a little differently. So I'd really like to hear more about that.
Yeah, I think it's a partnership with the AFL-CIO, SEIU, and a couple of workforce entities, one in the North Coast and one in Central Oregon. So they're working on registering the apprenticeship with BOLI. And once that happens, we'll try and bring it statewide. So you only have one labor management group that you need to work with. So that's sort of the strategy. And I think that will come online sometime within the next 6 months or so. So that's pretty exciting.
Yeah, it is. I'm wondering if the other union, AFSCME, is also participating, because SEIU supports license exempt childcare.
Yeah, you know, I'm not super familiar with the details, so, but I do know that that whatever unions represent childcare workers or would like to represent are at the table. So I think it's good news.
It is.
You know, I think to Julie's question, I mean, if you raise, I think this was your question, Julie, like, if you raise the wages, it raises the cost, and the costs already seem really, really extreme. Like, my kid's 20 now, but I do recall when he needed childcare, I was paying, $1,500 a month. And there was 20 other kids in his class, and it was like him and an assistant. And it's like, well, how could he not afford to pay himself well? So it's just it's a mystery on that end, I think, a little bit.
So actually the childcare field, both centers and family childcare have actually razor thin budgets for profit, and sometimes actually go into a deficit. So they are not making money on it. Absolutely not making money. And so we have put the burden on parents and childcare providers, and that needs to be lifted for both. That's a huge issue too.
So that speaks to my question, Karen. The fundamental model that we have seems flawed.
Yes, it is.
Are there actions being taken to look at other innovative models? Because, throwing more money at this doesn't seem to necessarily satisfy the issue unless we decide to, tax society, which is a model, to share the burden across the country in a way that we do for public education, for example.
Yeah.
Well, I don't know if Begoña might be saying this, but that's really what, we're talking about with Preschool for All. Is hope. How can we create a universal childcare system to support families that is funded by multiple entities and supported? We have to look probably at different countries for that.
Yeah, and actually we are meeting next month, like different leaders from the early learning sector with the early learning division, and to take a look at some case scenarios, and we will have roundtables to discuss about models that exist in other states or other countries to see the things that we can replicate. So we might be able to bring something. For pre-K for all, we actually look at the Multnomah, Seattle, and Denver models, but all of them, they have deficiencies as well. But it seems that the Seattle and the Multnomah could be closer to what it might be the best fit for our county. But at this point, we are just looking.
So, well, and again, that's preschool, right? I'm hoping that at some point, Baby Promise, which is childcare for children under the age of 2, will come to Washington County. It's piloted in a few counties in the state, but we're hoping for that expansion to come soon as well.
I think, Glenn, too, I mean, we talk about this a lot. It's a recognition that our education system starts at 0. It doesn't start at 5 and 6, and that's there's a societal recognition that needs to happen. So that's exciting. What's exciting about that preschool for all movement is it is shifting that, I think, dynamic, because any of us who've had any touch in this field know all the studies that are out there about how critical 0 to 3 is in a child's development and their long-term success and the long-term impacts on our community. So it's like the data is there, it's the political will to shift, and broadly just recognizing education starts at 0. And that's where, so I think that's a big shifts need to happen in societal thinking.
Yeah, thanks, Kim. Katie.
So this is Katie. So I think that this echoes a lot of what I talked about in our previous meeting too, that it's not just 3 and 4-year-olds. We really need to look at 0 through like 17 or 18. And the whole system needs to be basically subsidized in order to help kids out and families out. And so this is part of what we have been talking about as well. And I wanted to add another little bit of information. I think the information that has been given about what's going on in early childhood in Washington County and the state is very helpful. And it gives a lot more depth. I wish we had that kind of information regarding school age care and summer care because we don't have that information. The League of Women Voters has authorized an update of their childcare study, which was last done in 1988. And so they will be taking a look at things, and I'm working on that. And anybody else who's interested in working with the League of Women Voters of Washington County on that study would be great. That would be very welcome. And you know, Karen and Begoña will be contacted, I'm sure, about getting information from them too. So, you know, we're supportive of having care for all kids and those who need it. So I just wanted to emphasize that.
Thank you, Katie. I think that one concern that everybody has is the more that we speak about pre-K for all or OPK or preschool promise, Head Start, it is how is that thing being impacting the infant and toddler providers. So are some of them gonna say, guess what? I'm gonna move from pre-K into infant and toddler, or guess what? I'm gonna exit the infant and toddler because everything like pre-K is subsidized. So that is a risk that we might be facing, that we might go either way. And we are putting our heads together to think about solutions. And I don't know if we will come up with any at this point, to be honest with you, but this is not like a 1 day, 1 year work that is ahead of us. This is like a long-term issue that we have to be reducing until we can solve it finally.
I'd like to ask a quick question. And Glenn, this is actually for you. I went to some of those early meetings a few years ago with Thrives, and my impression was the vision was to incorporate affordable housing, childcare, job training together. So it seems like that could be a potential solution to some of these problems. So I was just curious about the status of that.
Yeah, our priorities have not changed since you were involved in the earlier days when we established those. We are now, because we had such a focus on housing, we have begun to turn our attention to workforce and early learning. And we've expanded early learning to include youth as well. So it's enrichment for youth along with the early learning. So that's why we're having these particular conversations, and we had one earlier on workforce training. But I think the benefit of Thrives and what we've aspired to do is to identify where the intersection of these issues is at play and how we might approach them from a more comprehensive perspective. And you know, it's difficult to do. Obviously, everybody's got their niche in which they're focused. We're trying to make those connections. So thank you for bringing that up, Elisa.
So is there some work being done to put like childcare centers in affordable housing?
I can speak to that a little bit, actually. One of the challenges with that concept, I mean, anybody who's an affordable housing developer right now, and anybody who is a provider of early childhood services is very interested in making that work. And one of the barriers that we run into is the restrictions that come with how money gets to be used. So if we're an affordable housing developer, when you're building a property, you can only use that money for the housing units. And so even if you have a mixed use space that may have room on a bottom floor, for example, that you could house somebody, as Karen was sharing about the barriers of space and the cost of that, that still has to be carried often by the provider potentially. So, you know, to take us as a case in point, you know, we have to be looking at, I mean, we have to consider it. We have a capital campaign, like to start getting funding, getting permission, or finding other sources from the legislature, other funders to start putting that together. What is kind of neat, though, that happened in this last legislative session is that the Office of Housing and Community Services did get a portion in their budget. I think it was about $10 million to start being able to provide that funding for that sort of collaborative project that'd be funding to support childcare space in an affordable housing development. So I know if Rachel Duke was here, I know she and I have talked about it a few times off and on, and so how that might start to roll out in our communities across the state could be really interesting. And so there is potential and a recognition of that need that we want to meet, and there's a gap to making that happen. And there is some money and support coming that could probably start to help bridge that, which would be very, very exciting.
Great, thank you.
Couldn't some of the money from the wraparound services initiative be used toward that? The second metro initiative?
I think less likely. It's much more dependent. I wouldn't be able to say. I think it's much more on the services to support homeless families and individuals. So possibly, but I don't know the details of what the local plan incorporates.
Yeah, a portion of it goes towards prevention, but it's a gray area as to what we mean in terms of services that might help prevent.
Yeah, and it is about service provision, not the stick and bricks piece.
True.
Okay.
Other questions? Okay. Well, Karen and Kerry and Begoña, thank you so much for being our presenters today. We appreciate the information and you fielding questions. We are, as far as the upcoming meetings, we're going to take August off. So we will not have a Thrives collaborative meeting in August. So the next one that takes place is September, whatever that third week in September is. Somebody might be able to check a calendar and help me out there. I wrote it down, but I don't have access to it right now. And I'm curious if, say again, Julie?
The 15th is the third Wednesday.
Thank you very much. I'm curious, I love the fact that Begoña had put in that last slide, you know, some things that folks could be thinking about action oriented. I think we as a group need to be thinking collectively about, where can we leverage our influence? And I don't know, Kemp, when you were talking about the conversations taking place around preschool for all, if there is opportunities for us to lend our voice to policy related decisions, funding related decisions, I think that's always an easy lift for us. If we can just be putting our names and organizations and logos on letters that speak out in advocating for these types of programs, policies, funding that support our priorities, that's an opportunity for action. But I'm curious if folks have any thoughts about where we want to take our conversation next for our September meeting. Know that we have a leadership team of which Kemp and Katie and Brian and Andrew. So there's 4 people, John, there's 5 in the room here that are part of that leadership team that are helping kind of craft agendas for our conversations. But if you have ideas, if you've got anything you want to throw out right now, we've just got a few minutes here before we adjourn. I'm happy to hear that. Or if there's anything else that came up for you, let's just open the mic up.
I don't know if Begoña would want to say any more about the preschool for all in Washington County, and just, I don't know, to your question, Glenn, about where are the avenues where I know there are already working groups kind of convened, so I don't know if there's a need, is there a need at the moment for additional participation, or will there be listening sessions, or where are those opportunities they envision popping up for people to be plugging in like Thrives?
I think it might be a little bit late on the game. We are actually sponsoring the research, but the one leading the initiative for now is the Northwest Regional ESD. But yeah, Kemp is correct. There is a task force that is meeting the last Friday. And then there is the program and policy work group. And the last one is the infrastructure. But actually we submitted a lot of names, but we were not the ones signing them off. It was Bridget and Olga, that they are the co-chairs of the task force, but they were in charge of selecting the people that will participate in each of the committees. But the thing is, when this thing is done and then we do the polling, then there is actually, this will belong or should be part of Washington County, right? So this is when I think that there will be different opportunities to engage, because now we are doing the research, the assessment, right? But we are not making decisions about funding or anything, because we cannot make those decisions. We can make recommendations, but ultimately it should live within the county. So that is when the real work, meaning decision, will happen.
And Begoña, do we know when that assessment phase will be completed? What's the goal?
Yeah, February.
Okay, so maybe we can invite you or whomever is representing that group, we can invite back for.
Actually, Bridget is part of Thrives, right? So she's
Bridget Calfee. Are we talking about Bridget Calfee or Bridget Cook?
Yeah, Bridget Cook. Adelante.
Yeah.
So she is the co-chair. So we might invite Olga and Bridget, and
perfect.
So that, and Megan Irwin as well. But I was gonna say, obviously I cannot suggest topics for next meeting, but I'm gonna do it. So you know that you guys have a lot of connections with the interfaith, and I know that they have a lot of empty spaces, or spaces that they might not be really successful at running their businesses, and they might be rethinking or repurposing those spaces, and they might not know what to do with them. So I wonder if we could have a conversation about, you have a space, we have providers, right? Can we match them? So that will be really great.
Excellent. Okay. Let me see if I can figure out a way to communicate that. We can certainly make that connection. Thank you for that.
Thank you.
Anyone else? All right. I want to thank everybody for being here. I hope you have a wonderful rest of your summer, and we will be in touch regarding the September 15th meeting. And so with that, I bid you adieu. Thanks, everyone.
Thank you.
Take good care. Be well.
Bye, everybody.